I'm Dr. Carolyn DeLucia. I'm going to talk to you about what happens as we lose our hormones in life and the symptoms that start to appear as this occurs. Get hot flashes, which are a range of horrendous heat coming out from inside you and making you sweat and feel terribly uncomfortable. A lot of my patients describe getting hot flashes in the middle of a meeting and pouring sweat and people asking them if they're okay. It's an embarrassing moment in life. And then we get the night sweats when we're so hot and our partner in bed wants to put the blankets on and we're trying to pull our clothes off because we're so hot and full of sweat and we have to actually change either our sheets or our clothing. The other issue is loss of energy. I call it emotional swings, where you get so angry you don't even understand why you're so angry and you can't talk yourself down, or you're so sad you can't stop crying and no one understands why, and your partner says to you, "Who are you and what have you done with my wife?" So it's a very difficult time in our lives to go through these changes. More changes that occur, let's not even discuss what happens to us sexually. We lose our ability, we are going to discuss it, we lose our ability to feel sensation and perhaps to reach climax, and we have pain with intercourse. It feels like our partner's wrapped in sandpaper, and it's a very uncomfortable and embarrassing time for us. So what have we had so far for vaginal lubrication and for loss of sensation and for our mood swings? Well, some products are over the counter. There's some herbs that are available like Dong Quai and black cohosh, soy products, but a lot of these supplements can have some consequences that you have to be aware of. So please, when you use them, always tell your doctor that you are taking supplements so that they can explain those risk factors. Some will thin your blood, some may cause liver damage. So please be honest and share what you're using. If you have thyroid disorder, you may not want to be using soy. So moving on to prescription medications, we use mild antidepressants because of these gigantic mood swings, and we have discovered that some of these medications can minimize our hot flashes and perhaps help us sleep at night. It's a band-aid. It's not a cure. We're not going for the cause. We're trying to treat the symptom when we use these medications. The next approach is to go for hormones. What's happened with hormones in the United States? Why is everyone so afraid of them? Well, back in 2002, there was a study called the Women's Health Initiative, and during that study, the outcome was that the hormones used in the study increased our risk of heart disease, increased our risk of stroke, increased our risk of breast cancer and dementia, for heaven's sake. So, with all of that, we stopped prescribing those particular types of hormones. Those were synthetic hormones, not bioidentical hormones. And those were synthetic estrogens as well as synthetic progesterones. Nothing that our body would identify as normal. So then out came all our bioidentical pharmacies, and they really tried to make a good product. Unfortunately, the dosages vary and are very difficult to control. So this year, I was so fortunate to find BioT. And that's B-I-O, capital T, capital E. And that T and E stand for bioidentical testosterone and estrogen. Women lose 1% of our testosterone every year from the age of 30 on. Initially, we may not feel the changes, but once we hit in our 40s, all of a sudden, a lot of women say, "I don't have any libido, I do it because I have to." Or it becomes less sensitive, less enjoyable. And with estrogen, all these other, the hot flashes, the mood swings, weight gain, truncal obesity, all of these things come with our loss of estrogen. And by replacing them with estrogen and testosterone bioidentical pellets, which go under the skin and dissolve gradually over 3 to 4 months in women, we have the ability to have a very natural return to the way we used to feel. So please, if you're interested in being evaluated and to see if you're a candidate for BioT, call us